Hi, this is Mrs. Lewicki, and this is the voiceover PowerPoint on the concept of clinical decision making. Now, I did post a lecture on this same topic, so this is just a little bit more detail. So, we've talked about this already, but clinical decision making is a process that the nurse uses to evaluate and select the best actions to meet the goals. So, this can be life and death decisions or day-to-day activities. Sometimes it's you don't have a clear answer of which things should happen first or what the next step should be, and so we use clinical decision making to help us in that process. Part of that is critical thinking, and that's the name of this course, is critical thinking. So this is all or part of process of questioning, analyzing, synthesizing, interpreting, inference, inductive and deductive reasoning, intuition, application, and creativity. All of these are used as part of critical thinking. And so that involves a deliberate, nonlinear process of collecting, interpreting, and analyzing. And what we mean by nonlinear is that you're watching the patient as a whole. You're hearing what their family is saying. You're listening to the communication. You're watching them. You're asking them questions. It's not just a direct, I ask you a question and you answer. You're looking at for other information while you're gathering that data. So intellect is the ability to think, understand, and reason. And we use that to help us differentiate between facts and opinions. It helps us to approach situations objectively and clarify concepts. There are cues about intellect. It can indicate a negative or positive change in patient's health status. It varies from norms of patient population. So what's the normal in your area or your facility? And if the intellect is not there, it can help indicate a developmental delay. Once it's recognized, then cues can be clustered to look for a pattern. So it's one of the things that with nurses, and you know this already as licensed LPNs, is that you need to remain current and in order to maintain high quality patient outcomes. Creativity is another skill for critical thinking, and that's an outlet for imagination. It allows the nurse to take what can be seen in mind and make it tangible. Tangible is the word I'm trying to say. Find unique solutions to unique problems when your traditional interventions are ineffective. And so sometimes we have to be creative to try to come up with a solution. One of the things that we did collectively, I guess, as society, was when COVID-19 came about and we found there was a shortage of PPE, we were looking for ways to make face masks out of cloth for use at home, but also to help the nurses. And so that was a solution that came about in a non-traditional way. It helps us when we're creative to individualize the patient care. And creativity is sometimes considered thinking out of the box, which I'm very guilty of. And sometimes people will say I don't even like own a box because that's how far outside of the box I sometimes think. It helps you, creativity helps you come up with better alternatives or more options instead of just one. Inquiry is the search for knowledge or facts. It examines objective information to gain clarification or find solutions to problems. It's a little different from query. Query is that we're asking the question. Inquiry is we're trying to find out almost a root cause of the question or what more can we learn about the question. Critical thinking requires the use of inquiry to examine the situation at hand and sometimes examine our own nursing practice. Nurses use inquiry continually in the clinical setting because we're continually trying to figure out if the patient's status and is it improving, is it not improving, is it deteriorating, and it can help resolve clinical problems and issues and improve patient outcomes. Reasoning, I'm not going to talk about in this voiceover because I did talk about that in the lecture. but I'll be slow on this slide so that you can read it. And same thing with reflection. I talked about that in the lecture, so refer to that. Intuition is a gut reaction. It's part of a nurse's reasoning and analysis of data through all their senses. And sometimes it's not part of our conscious awareness. Sometimes we build our intuition through experiences. And we'll talk about that in the next lecture. But intuition is internal. And you've heard of a mother's intuition. That's the same thing with nurses. Nurses develop this almost a sixth sense. You have use of nursing knowledge, experience, and expertise without a conscious use of your reasoning. It's a valuable cognitive skill for professional nurses, and it's basically you're taking your learned experiences or what you've learned through patient experiences and clustering the patterns and the similarities. And it's really not something that you as a nursing student or as an advanced beginner nurse would really have developed yet. So we do make a lot of decisions throughout our day in clinical decision making, and sometimes they're value decisions, sometimes they're time management decisions, sometimes they're scheduling decisions. Scheduling decision, my patient's going for surgery, I've got these meds due for another patient and somebody else is complaining of pain. And so I have to prep a student for a patient for an x-ray. So I have to decide what order I'm doing things in and prioritize those. And same thing with priority, which patient is sicker, who needs to be seen first. And nurses also help patients make decisions. And as a nurse, it's important for you to have strong clinical decision-making skills. And right now, you're a beginning nurse and you're not going to have the clinical experience or knowledge to make the decisions, but eventually what you're going to do now is look for guidelines to help you make those decisions. And some of those are decision trees or protocols. I talk about the steps in making decisions in the lecture. Here they are written for you. Another thing is sometimes you have to choose among alternatives, and I talked a little bit about that in the lecture. But sometimes you have to decide what alternatives do you need to use before taking actions. So priority care may dictate that. Somebody who can't breathe, that becomes your priority. And when we talk about prioritization, we'll talk about ways that you look at making these choices or tools we have in our toolbox to help us make these choices. But you're always looking for why you're making that decision and the good and bad of what those decisions are. Why is this decision better than the others? And you want to look at, are there adverse consequences to all parts of that? Is there always just one best alternative? And should we look at every alternative? We want to watch our patients for cues and that form patterns. So I'm not going to read all this to you, but you're looking to cues from your patient, and it's going to help you to prioritize. Is it a breathing issue? Is it a cardiac issue? Is it pain? Where's my issue? And then regardless of your experience, all nurses cycle through alternatives until they find one that's the best choice. And sometimes, if there's time, you want to kind of rehearse that choice, rehearse that decision. We do talk a little bit here about problem solving, and we use the nursing process, and I talked about that in the next video. But other things we do is trial and error, and I talked about that already in the lecture. We've talked about intuition. The other thing that I mentioned is the scientific method, and that's a formalized, logical, systematic, investigative approach, most successful in controlled situations. And health professionals use a modified version, so we use a problem-solving method. Clinical judgment is the end product of complex process of clinical decision making, and I did talk about this in the lecture. I do want to point out that as a beginning nurse, you're not really expected to have clinical judgment. that's independent thinking. We want you to rely on the textbooks and the data and the experienced nurses to develop your clinical judgment. I talk about this in the lecture. That's Banner's skill acquisition model, and we look from novice to expert, and your level of competence will build as you gain nursing experience. Tanner's clinical judgment model, it emphasizes the importance of the elements nurses use in cognitive processes, and we talked about this. This is the theory of noticing, and so your features of the model include noticing, interpreting, responding, and reflecting. And Lasseter developed a rubric based on that. We often use this in simulation, and it uses the Tanner model to evaluate that. And I didn't talk about lifespan considerations in the lecture, but you do want to consider when is it appropriate to include a child in the decision making versus their parent. As a child, you do always have to include the parent, but sometimes you don't include the child, depends on their developmental level. Pregnant women, you want to include them in their decision making. And we tend to, in the U.S., do a mutualism that involves shared decision by the woman and the provider. Older adults, if there's impaired cognition, you may need to involve a family member, but you do want to have them have as much input as possible in the decision making. And some concepts related to clinical decision making, I'll just go over these quickly, but some of these you haven't covered yet. One is accountability, another's cognition. Cognition you might have done already in pediatrics. Collaboration, we do that in complex sim. Communication was our last one. Safety you do in essential concept, and thermoregulation you also do in pediatrics. And that is the end of this voiceover.